So I think I'll go ahead and start this introduction of this concurrent session on maintaining compassionate care in the age of AI. So opportunities for nurse-led research and co-design. I'm really honored to be here to introduce this session, and I'm Dr. Mandy Archibald. I'm a research scientist with the Children's Hospital Research Institute of Manitoba, as well as an assistant professor in nursing at the University of Manitoba. And I run a research program around research methodology, integrating innovative methodologies such as arts-based approaches, technological approaches, and mixed methods research for research impact across disability and various chronic disease contexts. So you may have noticed in the chat that we do recommend for optimal viewing and recording purposes that you go ahead and mute yourselves, as well as keep your cameras off. And the optimal viewing platform for you today is to hide the non-video participants. Okay, so I'm just absolutely thrilled to be introducing our speaker for this session. Dr. Elizabeth Barecki is a professor in the School of Health Information Science and Director of Global Laboratory for Digital Health Innovation at the University of Victoria. So in addition to being a real nurse leader and just a lovely individual as well, she's a clinician scientist with the Michael Smith Foundation for Health Research and a fellow of the Canadian Academy of Health Science Informatics, the American Medical Informatics Association, and the International Academy of Health Science Informatics, established by the International Medical Informatics Association, IMIA. So Elizabeth is very prolific, has published over 200 articles, 40 book chapters, and 10 edited books. The focus of her research and publications has been in the areas of health, technology, safety, human factors, virtual care, such as mobile, telehealth and smart homes, and health technology implementation. She was voted one of the top 10 women in digital health by Digital Health Canada in 2018, and the top 100 health sciences informatics professional globally by IMIA in 2017. So internationally, her work has included serving as academic representative for Canada, for Digital Health Canada in 2007 to 2013, Vice President representing North America on the Board of Directors for IMIA, and that was from 2010 to 2013, and Vice President Special Projects 2016 to 2019. Elizabeth's contribution to nursing informatics include leading the development of Canada's first double degree program in nursing and health informatics, and she's also the inaugural editor-in-chief of JMIR Nursing. So please join me in welcoming Dr. Elizabeth Barecki. Her presentation has been pre-recorded for quality assurance, but following the video, she will join us in person for an ongoing discussion on the topic and to answer any questions. So given the nature of this presentation as well, please use the technology available to you. Throw your questions in the chat box and we will pay attention to those and share your impressions of the presentation and this moment on social media using the hashtag nursing and AI. Thanks very much and welcome, Elizabeth.
Hello, everyone. It's very nice to be here today and to have the opportunity to speak and also have a chance to answer questions and discuss how nursing and artificial intelligence can lead to compassionate care. So I'm going to start off a little bit in and around the area of artificial intelligence and some of the definitions as one of the areas of research as well as healthcare practice. So what I thought I'd do is start off by first defining artificial intelligence. So artificial intelligence essentially refers to the ability of a digital computer or computer-controlled robot to perform specific tasks commonly associated with intelligent beings. It also involves developing systems endowed with intellectual processes characteristic of humans, such as the ability to reason, discover meaning, generalize, or learn from past experience. There's a range and scope of technologies that are associated with AI. In fact, it's a really extensive research area. And so, for example, technology and AI involves a lot of different technologies such as intelligent databases, natural language processing, machine learning and data mining, neural nets, deep learning systems, predictive analytics. It also includes things such as bioinformatics, genomics applications, as well as automated image processing. In AI, there's a number of different domains. If you look at this diagram, for example, we have machine learning, which has been applied in healthcare, looking at electronic health record data and trying to identify patterns of data that would allow one to see a predisposition towards disease. There's work in expert systems around decision support tools, fuzzy logic in terms of looking at different types of images, neural nets in terms of supporting decision-making, robotics in terms of supporting surgical procedures, and natural language processing, which can be used to look at text-based data in order to identify patterns and also to help support decision-making. When you look at AI, I like to look at it in terms of a broad range of technologies. And one of my favorite theories is actually Rogers' innovation diffusion theory. And if you look at all the different technologies that I've mentioned earlier here, AI is also going through the process, each and every one of these technologies, from an innovation stage through to early adoption, early majority, as well as late majority, and then laggards. But to contextualize it a little bit more, adoption actually takes place for every single technology that we have out there. So right now, this is a really nice example because it kind of gives you an idea of different types of technologies that we've adopted over the years. Some of them have been successful and others haven't. So a good example here is the microwave, the cellular phone. And you can see that each of these technologies has a characteristic, a shape curve. And they've also extended through to podcasting and, for example, tablets. And there's also some really nice diagrams of how electronic health records and different types of mobile apps have gone out and been adopted. And now AI is also going through a little bit of phase. So in as much as we can say that it's being adopted, it also is subject to this idea of a hype cycle. And when you think about all the different technologies that are out there, oftentimes there is the innovation trigger. So there's a technology that's developed in this area of AI. And you can see there's a number that have been developed over the last few years as part of this innovative process. What happens over time is that there is a peak in terms of expectations around the technologies. In some cases, the technology actually lives up to that peak, and in other cases, it doesn't. And the vast majority of technologies oftentimes go through a period of what they call the trough of disillusionment. And as time goes on, the technologies that are viable, the ones that can be applied in given settings such as healthcare, actually make it out of this into the slope of enlightenment, as well as how it's used in order to essentially improve productivity in a particular support care. So what is AI in healthcare? I like to think about AI in healthcare as the intersection between healthcare computing and health informatics, and part of that is nursing informatics. AI researchers, health informatics, and health information technology professionals, and part of this group is the nursing informatics technology professionals, design, develop, and implement integrated computing and health informatics AI solutions in healthcare. So what types of AI solutions are out there? There's AI solutions from a health professional perspective that support things like, for example, recognizing patterns of wellness and disease, helping to diagnose the presence of disease, also helping to recommend different types of treatments that can be used in complex and simple patient cases. From a health administrator perspective, AI has been applied to things such as managing wait times in emergency departments, effectively using surgical resources, monitoring, predicting outbreaks of diseases we can see right now. And it's also been used, for example, to support decision-making around, for example, nursing staffing. Some of the key areas that have emerged in terms of AI's application in healthcare include things such as lifestyle management and monitoring, using different types of sensors and devices, patient data and risk analytics. So we're actually looking at patient data, doing analytics, and then presenting that in visual form that can be processed by a health professional and can be looked at, and then decisions can be made about care. There's a lot being done, as I mentioned earlier, in terms of inpatient care and hospital management in terms of resources. There's also AI that's been applied to emergency room and surgery supports. Medical and diagnostic imaging is a huge area for AI's application in terms of helping to identify tumors. It's been used in mental health to support individuals who are going through crises. We've also seen the application of virtual assistants and wearables, as well as the application of AI in drug discovery. I like to look at AI as a bit of a journey. It's a journey in essence to realize the potential of the technologies. So we know, for example, that new AI technologies and tools need to be developed. We have had in the last few years a bit of a flourish in terms of the types of technologies that have been developed, but they continue to be developed over time. We also need to understand and identify how AI tools can be applied to current gaps. So current gaps in health research, in the nursing research, and in health services research. Then in addition to that, we need to understand how these new research gaps have emerged from the introduction of these new technologies. So in as much as we create a new tool and we apply it to address a particular gap, in the research literature, in the process of applying the new tool and doing it successfully, we might identify new needs for new AI tools and new research gaps that need to be addressed in order to improve healthcare. And I'm going to use the example of robotic surgery. This is an area that's really quite interesting in that we've seen surgeries revolutionized by this particular technology. Historically, some procedures were actually carried out over a longer period of time. With the introduction of robotic surgeries, we not only have surgeries that can be the surgical time shortened, there's less invasive surgeries so that we have a better recovery. And in addition to that, we also have a need to develop new skills. So I'm going to continue on with the example of robotic surgery. So for example, this is a next generation technology that has reduced wait times because of the fact that you've reduced the amount of time that it takes to complete a surgery. You can actually conduct more of these types of surgeries. In addition to that, this type of surgery has also enabled health professionals, specifically surgeons, to be able to conduct surgeries that historically were difficult to do because of the location of the surgery or because of the complexity of the area where the surgery has to take place. Now, what's really interesting about robotic surgery is it has had significant downstream effects. I first got introduced to the use of this technology, I think it was about 10 years ago, where there was some initial pilot testing being done in surgical units in Europe. And what really interested me about it was the actual downstream effects in terms of nursing. So historically, we have your traditional OR nurse, but now this nurse also has to understand how the machine works in terms of interfacing on the surgeon side as well as on the patient side. And there's new roles and responsibilities that come with helping to set up some of these technologies, as well as support the surgeon during the actual care. So it's really important from that perspective. In addition to that, because the surgery has, in essence, allowed us to shorten the amount of time, shorten the invasiveness of the surgery, we have patients that are being discharged earlier. They're going home and they're being remotely monitored using telehealth approaches in order to be able to care for them. In addition to that, because the surgeries are in some cases used in cancer treatment, we've actually reduced the need for certain other types of procedures. So for example, you might be able to perform a surgery on a stage 1 cancer and may not need to have, for example, a radiation therapy or chemotherapy because you've removed the cancer early on, because the surgical approach has essentially created an opportunity to do that. But what does that mean for things such as nursing and compassionate care? I'm going to talk a little bit about sort of my journey in this area. I'll be honest with you. I love research. One of the things that I've learned over the last while is that as a researcher, one never really ends one's education. We're constantly learning from other individuals, as well as learning from the new tools and techniques that can be either designed, developed, or actually customized for a particular area. So one of the areas that I got involved in terms of research around AI is this whole idea of looking at developing different types of analytical tools in order to support graduate training for health informatics professionals, of which some of them are nurses. So this was a project that I got involved with computer science, and it was kind of interesting because, and it continues on today. It was interesting because it allowed me to actually learn about some of the different types of tools that were being developed even as we speak, and being tested for healthcare purposes. So the idea here is one has to understand that when you develop a new tool, first of all, you have to immerse individuals, so in this case, students, in the whole process of going out and learning about the tool, developing the tool, and then also customizing the tool and seeing how it could potentially be applied in a healthcare setting, as well as how it can be tested or validated in a healthcare setting. So there's a lot of things that actually happen up front before the tool actually makes its way into a healthcare setting to be used as a standard way or a way of practicing. Now, in this work, I've had the opportunity to work on different projects with students that involved developing tools for analyzing complex data sets, identifying tools that could be used in specific types of data sets. And that has involved a work around, for example, things such as data collection, cleaning, management, looking at what types of mathematical models could be used, what kinds of predictive analytic models could be used, and then going out and testing those models on data sets that in order to validate and see whether or not those models work. In addition to this, some of my work has also included some work around visualizations. So how do we take essentially a mathematical model, test it, validate it, and then provide that information in a meaningful way for health professionals to be able to interpret what's actually happening. And here are some of my students. They're doing some really wonderful projects. One of my students, Amarath, he's looking at developing COVID-19 predictive models for hospital treatment. Ryan, another one of my students, Ryan Kletke, he's actually doing some work around developing recommender systems and new types of user interface designs to help older adults to identify devices that support them in their homes. And last but not least, there is Amir Fargali, who's looking at e-prescribing data and looking at how you can actually provide ways of improving productivity for community pharmacies, as well as visualizing that data and then using those visualizations to support decision-making around patient care. So in this journey, one of the things I've found is that we really need to understand what kinds of things are happening out there in terms of the technologies. How can we, in essence, contribute to the process of the development of these particular technologies? And then looking at how we can spread that through education. And I've been quite fortunate because I've had a chance to work on both these projects with Kaizen in terms of understanding what kinds of competencies were needed from a nursing perspective in nursing informatics. I've also had the opportunity to spearhead from a nursing as well as health informatics side, graduate education in this area. So I think it was about 10 years ago now, the School of Nursing and the School of Health Information Science here at the University of Victoria looked forward and tried to identify ways in which we could actually advance both nursing informatics as well as health informatics. And one of the things that we talked about was designing a double master's program. So in essence, what would happen is a nurse would graduate with advanced competencies in nursing as well as in health informatics. And one of the most amazing things about this program is that I've had the privilege to be able to meet nurse leaders that are, I should say, individuals who are nurse leaders today who had an in-depth knowledge of both nursing and health informatics. And as a result, we're able to identify important and key nursing informatics questions that could be solved using technologies, could be involved in design and development of technologies that would enable nursing to provide better, more compassionate care, as well as to use those technologies to improve the care of patients from a health systems perspective. But as with all programs, one of the things that I've found over the years is that we really need to still consider the issues and challenges associated with nursing education. One of the things that has really come to mind over the years is that in as much as we have created competencies for undergraduate nurses and we have developed programs for graduate nurses, and when there's expectations around what a graduate prepared nurse informaticist can and cannot do, with the introduction of these new technologies, there is a continual push towards, in essence, advancing the competencies at both levels. So, for example, nurses who graduate from undergraduate programs in the next few years will need to have an understanding of what AI is and the technologies that support it. They also need to understand how AI, for example, affects their cognition, how it affects how they do their work, what are the implications in terms of safety, as well as looking at legal liability around AI, because it does actually influence how one thinks and what one may do. As an AI innovator, what I think we're going to be seeing increasingly, because there are nurses who are already involved in doing this, is we're starting to see nurses who are actually designing and developing AI tools. And at the level of coding, and also at the level of developing those mathematical models, including testing and validating those models, and also projecting out into how those models might be integrated from a nursing perspective. And I fully expect that the number of nurses who will engage in this area, whether from an industry perspective or research perspective, will continue to grow as there's greater interest and participation in the process of understanding AI and its technologies. And here's another example, a little bit of work that I've also done in terms of looking at AI's application in the context of dermatology. This is a federal Canadian digital supercluster project that I'm involved in. I'm just one individual as part of a large team that is actually doing some work around studying how different types of point of care dermatology solutions can actually be integrated. And the one that we're specifically looking at is the early diagnosis of skin cancer using machine learning and AI. So in that project, what our objective was to look at how a particular AI-based imaging system could be actually integrated into more of a province-wide healthcare system. What's fascinating about this particular project is it has, in essence, in many ways, looked at how we can actually improve the accuracy and the diagnosis of potential melanomas. But when you start looking at these technologies, it's a tool, we've developed it, it has a strong ability to identify potential issues in patients. We also need to understand how that fits in the broader context of healthcare. So how do we integrate the technology? What does that mean? So who's going to take this technology and who's going to use it? So for example, physicians might use it, but also nurse practitioners might use it, or even patients might be using the technology in terms of capturing that initial image and sending it to a nurse practitioner that they may be working with because they are concerned about a particular lesion that has developed. So there's a lot that needs to be considered when looking at the tool. So, there's a tendency just to think about the tool as some separate entity that's going to improve a particular management of a disease, but one also has to look at it in the broader context. So why would you think about these types of tools? So in this particular case, in the case of getting treated for a potential skin cancer, we know that, for example, patients can spend a lot of time waiting to see a specialist. And we also know that early intervention improves survival. So if we catch the skin cancer in stage 1, it's really important to be able to do that because it improves survival rates. So one solution is to have a picture that is taken by a smartphone, and it could be taken by a patient, it could be taken by a nurse practitioner, uploaded to a system, and then there's some AI image analysis software that might help with looking at that particular image and then comparing it to other types of images. And so in essence, what happens is it's a sort of form of decision support where you can look at it in context. So what does that mean? You know, we've been able to identify a potential cancerous lesion quickly, and there's this tool that we can do that. So historically, it might have taken quite a few months to get to see a dermatologist, for example. So you might have a lesion, you might have to wait for referral to a specialist. It might take a while to get the examination, then we've got biopsy. There might be some time period that's taken for results, and then you have a confirmation of cancer, and then you're waiting for treatment, and then you get treated. Suddenly, we introduce this new tool, and we need to understand how it fits into the healthcare system. So, for example, now you can take a picture. You can use the AI technology to review that particular lesion online. If you might have your nurse practitioner look at it and make a decision to do a biopsy and get the results, and you have a confirmation of a cancer a little bit earlier. And some of this is actually being done in some countries, especially in rural and remote settings. And then the person receives the referrals and gets treatment. And that time period might be shortened considerably. So from a nursing perspective, what does that mean? So here we have something that that can be introduced. We need to know how it fits in the context of nursing. How does it affect our cognition? What are the strengths and weaknesses of the technology in supporting decision making? It also means being able to use one's clinical judgment in addition to being supported by the technology. As a nurse innovator, what does it mean? It means that we need to look at the technology and decide whether or not it has any value to the healthcare system, what impacts it actually will have on the health professional-patient relationship. It also means understanding how you might integrate that technology within the existing system of care. Very important from that perspective. It also means, too, that we need to not only look at the technology, but we need to validate it in terms of where it inserts into care so that everyone is aware of where it occurs so we can support what's happening with the patient. And that requires not only understanding the technology, but also understanding what effects it might have on a patient, and then also providing compassionate care within the context of the technology. Another area that I developed an interest in is this whole idea of telehealth and AI. And again, I would say to you, this is a bit of a journey. We all have journeys that we take with different technologies. And this journey involves a little bit of looking at what traditional telehealth is, looking at the application and use of smart devices, and then looking at it in the context of smart homes and virtual care. So in the mid around 2013 to 2017, I had this wonderful student, and her name is Danica Tubin, and she did some fantastic work in the area of critical thinking around nurse telehealth, and also in and around evaluating how technologies that are used in telehealth either support or enhance or even detract from nurse decision making and nurses' work in a telehealth setting. Really important from the perspective that nurses have a significant role in telehealth in terms of providing advice and also providing care, especially during across that continuum from simple to complex and urgent problems. So a few years later, I've had the ability to, through my research, start working with different types of smart home devices and how they might actually be applied in the home. And this work stems from this idea that if you are a nurse, then you could be working in a telehealth setting. You could also be providing supportive care in the home, and that the home is increasingly becoming more automated, so there'll be expectations around nurses being able to perhaps use that automation to be able to, for example, track if a person is having an exacerbation of disease. So one of the things that we've done here, and we're in the process of doing at the University of Victoria, is we're going to be building the smart home of the future. So, and this actual work is in progress, where we're instrumenting a smart home apartment, so we can do testing in and around how one might use different types of sensors and devices to be able to support an individual in the home. And I want to draw your attention to this because it's really important. Sometimes one can think of sensors and devices in a broad way and saying, yes, I can integrate them into my house. There's some things that are useful and some things that perhaps we might not use. We'll try them out, and then afterwards we go, well, that's not very useful in supporting some activity that I have in my home. I want you to rethink that in terms of looking at how these particular types of sensors and devices could be used to support an individual who might have a chronic illness, how we might collect data, and do it in such a way that we either, with the consent of the patient, if the patient is part of this process, use existing technologies that are there, or adding other technologies that might be useful for that particular patient chronic condition or issue. So suddenly the smart home becomes very important. You could have a smart fridge, a smart stove. You could have sensing devices that could ensure that a person is safe in their home. You might be able to use devices to monitor just whether or not someone has fallen. And these are the kinds of things that we're starting to move towards, and that increasingly our home environments, our built environments, are changing in response to because of the technologies that are available. Now, obviously, if you collect a lot of data, that can be really hard to sift through if you are a telehealth nurse, such as the one that's up here in the upper right-hand corner. So in order to get that to the point where a telehealth nurse might find it meaningful, we have to go through the process of creating predictive analytics and visualizations and ways of communicating. And I will say to you that this is part of developing out what we consider to be compassionate care, because now care can be provided not necessarily in a face-to-face home visit, but it also can be done virtually, and it can be done in a way that allows the patient to maintain their independence, but at the same time to be cared for. And this type of care will start to grow over time. So some of the issues and challenges from a nurse that is working directly with patients. Some of the questions that one has to ask as time goes on: what technologies do you put into a home? When do you put them in? Can you work with the patient in terms of looking at things, collected data from technologies the patient has? So, for example, they might be wearing a smartwatch. They might be wearing a device that monitors heart rate, or that was used originally for fitness, but now if they have a health condition, can you use those technologies? How would you use them? So a lot of this is actually being, in essence, looked at in terms of the development of the technologies and the tools, but also from the perspective of what is useful and what isn't useful, and when should it be applied, and what does the nurse and the patient decide to do. So this is that piece where they work together and they identify what is appropriate based on what's in the research evidence, as well as what the patient wants. So this is that piece where you have thinking about co-design, thinking about how you go about changing or revolutionizing the way work is done. As an AI innovator, you might, for example, as a nurse, think about what kinds of mathematical models you might want to develop in order to describe what's happening. You might look at what kinds of analytics are needed and testing out those analytics to see whether the nurse who's actually engaging with the patient remotely is able to understand what's happening and able to use that as a form of decision support around a condition. You might also want to look at how do we validate these particular technologies in different settings, so, or even in different chronic conditions, or even in different acute care conditions. So there's a lot of work that still needs to be done. In terms of some of the work, that a way of actually looking at this and simplifying it is one can actually look at using different types of health informatics and nursing informatics research methods. So one of the things I like to do when I look at different tools and technologies, because not all of them are going to apply, as we saw with the Gartner hype cycle, some technologies will be designed and developed. There will be attempts at application, and they will not work well. They may fail at that point in time, but others will be seen as valuable. They'll be integrated in some way, shape, or form in healthcare, and then they will also be used over the long term, perhaps even in different settings. But in order to do that, one really needs to understand early on when the technology is being developed, the tool is being developed, as well as afterwards when it's being tested. We need to figure out whether or not that actually works before we deploy it in a real world setting. So one of the things we do here is we try to look at how different health professionals and patients interact with systems and AI tools and how that affects their work. So you might look at it at an individual level, so an individual working with a system, so a telehealth nurse looking at a visualization based on captured patient data that was captured using sensing devices and processed using a predictive analytic, and then making a decision and what the impacts of that are and how we can look at that process and can it be integrated into healthcare effectively. You might look at it at a team or clinic level, or you might look at it in terms of the systems level, in terms of providing virtual care. You might also look at it in terms of how all of that works together and how it integrates and how, in essence, it supports nursing. Part of that work also involves doing some research in different types of settings. Some of the work that I like to do is laboratory-based. I have a preference for it in that it gives us a chance to see how the technology works, whether or not it can be integrated, and have a good conversation around how the technology's design might influence what's happening. And sometimes what happens is it's really helpful to do that in a lab setting where there's a chance for the nurse to, and the patient, to work with the technology, to play with the technology, to encounter the bumps. And then I'll give us feedback around how we can actually refine the technology to better support that compassionate, caring relationship. To make it a little bit more complex, after we've kind of looked at the technology and tried to optimize it, we also like to use real-world type situations. So we use clinical simulations in order to be able to test it out to see how well it works. And we use simulations that are informed by nurses and other healthcare professionals and the patient so that they're realistic and they actually push on that technology in a realistic situational context. And then once we work through that, we go into the naturalistic setting and we start to see whether or not the technology can effectively be integrated. And we get feedback from that, and if it does, that's good. But if there are issues, then we have to go back and we have to figure out ways in which the technology could be modified, the implementation process could be modified, or we decide that it may only be effective in certain settings under certain conditions. So all these things need to be looked at when thinking about AI and integrating it into settings. I also like to, and I'm just going to bring this slide in, and I think it's important because a lot of this has to happen at different time points. So it could happen before a health information system is implemented. So it's that design, development, the procurement process, the implementation processes. So this is that innovation piece where we're looking at the AI tool or the technology and trying to sort out how we can design it, develop it, and then optimize it so that it's before we actually go and implement in a real world setting. Then we have to also track it afterwards. How does it work? Is it effective? Should it be maintained? Is it only effective in some areas? And then we also have to look at it in terms of if it has been there for a while, how do we maintain it and maintain its safety and efficacy and optimization over time? So I want to leave you with a couple of key points. I think nursing and compassionate care will always be with us. We have to recognize that healthcare is changing, nursing's changing, and I believe nursing is driving these changes. And a lot of these technologies will allow us to essentially advance what we mean about compassionate care and even change it to be more compassionate. So I want you to think about these technologies in the context of their design, their implementation, and their use, and how we can actually forge a path forward in terms of bringing that compassion in from early on in the design and the development through to its actual use and optimization over time. The other thing I want to leave you with is this idea that nurses are providing care in varying different settings. That care is compassionate, and we need nurses to be able to provide compassionate care with digital tools. And that's something that's going to be important, and these tools will change over time. I fully expect that in the next 10 to 15 years, there will be other technological advances that nurses will take on, they'll design, they'll develop, they'll implement, they'll use. And as we forge forward, we can keep this idea that we have to create more opportunities for compassionate care using those technologies, more supportive care using those technologies, and care that doesn't necessarily take place in one setting but can occur in the context of society. This is a little bit about me. I just wanted to thank Arno for bringing me out to do this talk. I've been very blessed in that I have had the chance to work with the RNAO on the implementation of best practice guidelines and also in the development of guidelines for best practices many years ago. I like to think that some of that early work inspired me to continue working in the area of health technologies. And I also want to thank University of Victoria because they've been absolutely wonderful in terms of supporting my research, as well as the Michael Smith Foundation for Health Research in terms of helping me to advance some of these ideas, as well as do some testing and advance nursing informatics knowledge. So I'm very proud to be a nurse, and I'm very proud to be someone who is trying to integrate technologies in a better way for patients to support that compassionate care. Thank you.
Thank you so much, Elizabeth. That was a really remarkable and timely talk for us all, a lot of food for thought as we continue considering the opportunities for nursing leadership in co-design in terms of compassionate care and the integration of AI technologies in that space. Also the possibilities for health systems impact by utilization of these approaches was really fantastic. And I personally really appreciated the sentiment about the involvement of the client and nursing perspective and how integral that is into producing models and technological innovations that meet the needs of health service users and health systems. So thank you so much for that. And thank you so much to participants who have been really engaged in our chat. It's fantastic. I wish we had more than a grand total of 1 minute to have a discussion. And so I'm just going to encourage participants, that hashtag I was talking about, hashtag nursing and AI, throw your comments up in and your questions in that on that platform, and let's see if we can't have a bit more discussion there as well. And I don't want to speak for Dr. Brecky, but I'm sure there'll be opportunity to reach out and hopefully vet some of these questions and hopefully make some of those connections since unfortunately we don't have time for the discussion that we were hoping to have today. One more housekeeping bit for us, however, is that you will have noticed a little bit of static at the beginning of the presentation. We're not quite sure why that was. The pre-recorded session didn't sound like that, and so we'll be happy to share that with you after the session, and hopefully we'll have access to a bit better sound quality there. So at this point, unfortunately, I'll have to move on and invite you to attend this next leadership panel presentation using the appropriate Zoom link that's been provided in the chat for you. If for whatever reason you do get disconnected, you can use the Zoom link that was provided to you in the confirmation email that you would have received upon registration. So thank you again to Elizabeth. It's been a wonderful session today, and I hope that we can get some discussion going in email and Twitter following the session.